So now that we know what the problem is and why it's being caused, now we can go after the root cause. How do we treat it? How do we go after this root cause? Remember, the root cause is always nerve inflammation. It's present in every single patient that I've ever seen in the last 29 years. There's a degree of it. Sometimes it's 50% of the equation, 80%, 90% of the equation. There's always a nerve problem with a plantar fascial structure issue. The origin of this condition we have to go after. The nerve problem increases circulation to the extremity. The increased circulation is then going to wash away those ions that allow for structural stability, causing the continual chronic fatigue and failure of the plantar fascia at its origin off the heel bone. Will also cause the same problem with the Achilles tendon. So we have to go after that origin. We have to go after that nerve problem because it's causing the fascial problem. Remember that. So the nerve problem, however, we can go after in the lower extremity, but if we just go after it in the lower extremity, we're going to fail. Ultimately, we're going to fail. We're going to make you better immediately when we treat you, but ultimately, if we leave that fire occurring at the back, and quite often that fire in the back could be subclinical. 10-12% of the patients have a subclinical entity occurring at the back. That means that we have a dime's worth of pressure on a spinal nerve root, spinal cord itself. Dime's worth of pressure, not a nickel, not a quarter. Just a dime's worth of pressure, and that creates enough inflammation to the spinal cord and the nerve rootlets that it creates this condition of the lower extremity. And other ailments at the knees, at the hips, at the ankle, other ailments of the foot as well. So when that nerve is aggravated, it controls the circulation of the entire extremity, increases the circulation like a fire hose, and it washes away those ions that allow for stability again of ligaments, tendons, even bone. Okay, so we need to go after that condition, that nerve problem. Going after the nerve condition and the problem at the lower extremity involves coming in, getting medicine around the ankle that consists of a local anesthetic. There's two pathophysiological features of the nerve: hypertrophy and enlargement of the nerve. That's one, and then it gets compressed. So we got to reduce the size of the nerve. So if we give you an anti-inflammatory around the nerve, around the foot and the ankle, consisting of that anti-inflammatory, it reduces the size of the nerve. We have pain gates, as we've discussed before. These are open gates. These are open pain gates. These gates need to be closed. The way that we close them is we give you a local anesthetic. Local anesthetic closes them, puts them to sleep for an hour and a half, recreate those communications, those normal communications, and they persist. They are maintained. This is how we reduce the nerve inflammation, by injections and medicine. Medicine, but it's only performed with a little medicine in your arm. You're sedated, you're relaxed, you're awake, you're conscious, you're talking. And that allows for me to give you medicine around the foot and the ankle that consists of those two contents: the anti-inflammatory to shrink nerves and a local anesthetic to close those gates. Now we can't just stop there, or else recovery is going to be short-lived. What is short-lived? I tell my patients, if you don't do these exercises for the back that are designed to restore your proper curvatures of your spine, that we expect for the return of this problem. So it needs to be done forever, these exercises to the back. And what they're doing is they are just simply decompressing the spinal cord and nerve rootlets. Okay, but those exercises are essential. And they're performed forever, 5 days a week, 3 days a week. It depends on the individual. Depends on the level of problem that you have at your back. We know how we treat the plantar fascial component. Everybody's getting that right. That could be oral anti-inflammatories, injections, arch supports, night splints, and then surgery itself. Okay? So everybody's getting that right. How I treat the plantar fascial component is we give you shockwave and we give you PRP. Shockwave is going to deliver a sound wave to the heel. It doesn't hurt at all when we're doing it. However, we do it with a little bit of anesthesia. That shockwave delivers that impulse, and our body responds, or the inflammatory response is augmented as a result of that. It's only got about a 50% success rate, so we have to add the PRP. The PRP is, we're going to take blood from you, spin it in a centrifuge, separate non-healing cells from healing cells, take those healing cells and administer it where the plantar fascia is ripping and tearing. This is what we do. You're able to run and jump as soon as we're finished. I ask you not to run and jump, however, for about 3 to 5 days. So if we're an avid athlete, I ask you to give me 3 to 5 days before we ask you to start returning back to participating in sports. Not at your pre-procedural level. We work our way up to our pre-procedural level. Okay? So that's what we do to fix this. Now, remember, I am a surgeon. However, this is purely an educational video. It's not intended to take the place of a doctor-patient relationship. However, if you are in New York City, if you are in New York or New Jersey, you're welcome to hit that link on my website and make an appointment to come on in and see me for hands-on personalized care. You're welcome to make a telemed appointment and we can discuss your condition. You're also welcome to receive my 5-point educational protocol that's derived from this clinical framework that I just gave you. One is we're going to teach you those exercises to the back that's specific for your ailment and your spinal cord. 2, we're going to recommend a device that goes inside your shoes that you can purchase from Amazon. It's only $18. It's not the $400 arch support that can work if it's plantar fascial dominated, but if it's nerve dominated, an arch support's going to make you worse. So we want you in something a little different. Thirdly is we're going to recommend a physical therapy modality for you that you can do in your house on your own. That's going to help both the fascial component and the neuronal component. We're also going to recommend nutritional supplementation that's going to help with the recovery of the nerve. Fifthly, we're going to give you a template for your physician where we explain what medications are best for this entity. Non-steroidal anti-inflammatories don't work on the neuronal component. That's why another reason why you're failing with the usage of that medicine. So we're going to recommend medications that actually do work. Okay, it was a pleasure being with you. Nice to see you again. I'll hopefully see you on the next video. Thank you.